So we begin with today's session. This is on our current medical knowledge, and start screen recording. अच्छा उसको दबाएंगे तब start करेगा. So we begin with our today's session on current medical knowledge, and current medical knowledge of psychiatry topic we have chosen today. A topic which is very much relevant for us homeopaths, because we talk too much about personality, constitution, and about the use of personality in practice is sometimes very much confusing, and each drug becomes a personality for us. In fact, there are two things. One is personality order, that is the personality type, and second is personality disorder. A personality order or personality type is formed by our education, by our culture, by our society, and there are so many factors, and it is said that by the age of 5 the basic structure of the personality is formed. We can't prescribe on that because we cannot change that. What is important for us is the personality disorder. Patients don't come to us for getting their personalities corrected. They come to us for getting treatment of their diseases. And while treating the diseases, we are required to take note of the disorders in personality so that the psychiatric aspect is understood. So from DSM-4, these 10 personality disorders have been accepted all around, and we can apply them to the Hahnemann's teaching and see the result. So for that matter, we have chosen these personality disorders. Now these personality disorders, which are 10 in number, these 10 disorders are clustered into 3. One is cluster A, which is paranoid, schizoid and schizotypal. Then there is cluster B, which is antisocial, borderline, histrionic and narcissistic. We shall, as we go ahead, we will understand the meaning of each, explanation of each. But as far as the words are concerned, you can remember paranoid has got to do with suspicions. Main thing. Schizoid and schizotypal are the personalities which are having schizophrenia. Is the word schizo is broken. Schizophrenia. Phrenia means personality. एक दिल के टुकड़े हजार हुए, कोई यहाँ गिरा, कोई वहाँ गिरा. So like that the personality is broken. Means one heart is broken, a poet says, into 1,000 pieces, some piece falls here, some piece falls there. That is the meaning of schizo. So schizophrenia. So these are the personalities which are disorder and of psychotic nature. Then antisocial, you can understand, asocial, antisocial. Then borderline. Borderline are the personalities which are having a tendency to go towards something. They are sitting at the threshold of abnormality. Histrionic. Now histrionic means which have got tendency to drama, tendency to show artisticness. They are telling you about their weakness, but in the process, I am always reminded of a joke there, that what happened that sometime there was a fire. Some lady set fire. She had actually bought some new gold bangles. Nobody saw those bangles. So she just put fire to her house and then said, "Aag lag gayi. It is a fire. It is a fire." Showing like this, it is a fire. Somebody said, "Hey, these bangles are new." Well, didn't you say this earlier? What was the necessity to put fire to the entire house? I just wanted to show my bangles. So this tendency to show something is not only in ladies, it is in everybody to some normal extent. But when it becomes abnormally high, that is histrionic personality. Narcissistic is a personality of Narcissus, is a god who got mad after his own image. You know, he saw his image in water and he fell in love with his own image. So that is what is their narcissistic trend. To a normal extent, it is there in everybody. In adolescent age, everybody wants to see his own image. 10 times, 15 times you see mirror, you put your comb. If you are a girl, put your lipstick, put your look at your brow, look at your face from this angle, that angle, at that particular age. So that gets over. But these are the personalities who become narcissistic. So this is cluster 2. And cluster 3 is avoidant, then dependent and obsessive compulsive. So avoidant, you can understand, they are avoiding everything. Dependent, they are too small, too childish, they depend on others. And obsessive compulsive is something to do with stickers in the mind, thinking, counting. So now we shall take these into consideration one by one. And what we shall do is, first we shall see the description given in psychiatry, their salient features. Second, we shall see how they can be converted into rubrics of our repertory to the best possible extent. And third, we shall see what are the drugs which are coming more predominantly or more prominently for this. And for this purpose, the book which we have referred is Bhattacharya Brothers' Psychiatry, that is Homeopathy Through the Spectacles of Psychiatry, is the yellow book, and there is a blue book, that is Known in the Unknown. So that is Unknown in the Known, and that particular, those two books you can get the material from there. But I have chosen to discuss this in short in this way. First of all, when we talk of paranoid, we see that the core of the personality, what is the central feature of the personality, is excessive suspiciousness. That the person is highly suspicious. Then there is alert, overcautious, very sensitive, and after that we see introvert, then less friends, suspicious, serious about everything, aggressive, then appear to be quarrelsome, uncontrollable anger, persecutory delusion. Persecutory delusion means somebody is following me, somebody is chasing me, being persecuted, and then jealous. So these are the basic features, basic pillars of the personality disorder as far as psychiatry is concerned. Now, rubrics chosen from synthesis. This is an endless exercise. You can go ahead with this. You can make your own rubrics and find your own drugs and keep it handy. This is just a thinking given to us because we are using it in day-to-day practice and getting results out of it. So ailments from mortification alphabetically disarranged: alert, angers easily, delusion persecuted, he is delusion pursued. Then after that there is hatred, then jealousy or jealous, quarrelsome, then serious and suspicious. You see, all these rubrics will not be a simple conversion because the book of psychiatry, what they write, those very words will not be exactly available. You have to do a sort of matching. After this matching, what do you get? You get leading drugs: anacardium, arsenic, aurum met, belladonna, hyoscyamus, ignatia, lachesis, lyco, mercurius, natramur, naxomica, phosphorus, platina, pulsatilla, staphysagrria, stramonium, and finally sulfur. So these are the drugs. Now we have not given marks to these, that is whether Roman or italics or bold, that can be done. In fact, continuous work is going on, and we are constructing some Dicasa rubrics. That is, Dicasa means digitally induced, Kent assisted soft program, something like this. So Dicasa is a program which we are working on, and we are entering directly into computer these rubrics, and the drugs which are coming out are in Roman, in italics, and in bold. That work is going on, and you can also do your own work like this. So that is about the first paranoid. Second is schizoid. Now see, initially it will be very confusing to you because these personality disorders are the personality disorders which are accepted by everybody, the general medical practice, and we have no opposition with them because they are classifying these into disorders, like they classify typhoid and malaria and all these things, and this, that is called nosological diagnosis in organic diseases. So similarly, psychiatric diagnosis is there, and we have to see the elements of that, and instead of giving them neurotransmitter substances or the allopathic drugs, what we give is our homeopathic corrective remedies. So here schizoid is reserved, taciturn, one who talks very little is taciturn. Then appears to be shy, calm, then quiet, absorbed in own world or activities. Remember, you are not going to call a yogi or a spiritual person who is sitting very quietly as a schizoid only on the basis that he is quiet and calm. These features have to coexist.
Taciturn?
Taciturn means one who doesn't talk. Silent. Taciturn, one who doesn't talk. Then there is indifference to family, indifference to friends, indifference to sex. So these are the features. And it is core is aloof and isolated. So he is aloof and isolated. Now rubrics we get, absorbed we get, answers in monosyllables, yes, no, nahin, only in yes, no. He talks. Then aversion to cohesion, company aversion to, we have arranged alphabetically, detached, indifference, introspection means thinking about his past. Then reserve, sight of people, avoids the sight of people, and taciturn, and last has in fact been hidden. I'll try to show that to you. See, it comes finally, somehow that point number next has been hidden. See, after reserved, then there is sight of people, avoids, then taciturn, and finally it is introversion. So that is the schizoid. Possibly that 11 point has come by mistake. So up to taciturn, this is conversion. I am just telling you how to do it. Now next is the drugs. Leading drugs are anacardium. Now anacardium is having a lots of symptoms of psychiatry, that is this mind which is a schizophrenic mind, because he thinks on one shoulder one angel sits and on another shoulder a devil sits. Now who is going to think like this? Not an ordinary normal person. That's a mind which is disordered. So anacardium has got a great potential. Then hyoscyamus, ignatia, natramure, opium, then phosphoric acid, pulsatilla, sepia, staphylos aureus, sulfur and fluja. You will find many drugs are coming here also and there also. Now what you are got to do, you have got to do, not prescribe only on the basis of this. From general to particulars, you see the features of the patient, repertorize them, and from general to particular, your job is now reduced. Your job, rather from matching the entire materia medica, has been reduced to this cluster of remedies, and from this you choose. So you are sure that the personality of the patient which is highest, because mind is the highest. So mind is covered, results will be there. Then third, schizotypal. Schizotypal is not only aloof. Schizotypal is one step ahead. It is strange. It is strange, eccentric. Eccentric means away from center. Cracked, we call it eccentric. Then awkward. Then superstitious, talking superstitious things, and not as a religious understanding, but highly superstitious. And the difference between superstitious and religious person is that superstitious person is his own idea. He doesn't have a group. Whereas in religion there is a group. His ideas are shared by others also. So superstitious. Then fantasy about supernatural power. Some fantastic ideas about supernatural power, that this I have kept it. Now somebody will come, he will just change the direction of this. I'll close my eyes, he will change the direction of this. If it is in the upside, that means that it is correct. If it is in the downside, it is wrong. And then he will patiently wait, and then afterwards say yes, there is a very slight deviation. So this is, what is this? This is something which is fantasy about supernatural power. Lack friends, because of this he is aloof, he doesn't have friends. Careless about dress. Then inappropriate laughter or behavior, strange activities, delusion of reference. Remember, idea of reference and delusion of reference. These are two things. There is a difference. Idea is correctable. Idea after argument, after explanation changes. Whereas delusion is a very strong idea. It is fixed. It is like a sticker. And that is what in Fuja. In Fuja what we say? In Fuja we have these strange ideas called fixed ideas. Now these fixed ideas can be OCD also, and the fixed idea can be delusions also. So delusions of reference, that means somebody is observing me. Like Kelkeya Karp says that I have got confusion of mind and my confusion will be observed by somebody else. So that is delusion of reference. Then fears crowds. So this is the core structure strange of schizotypal. The repertory wise we see absorbed in fantasy, awkward, then delusion, all powerful he is or she is, delusion being criticized, delusion of errors of personal identity, then eccentric, fear crowd, then laughs immoderately, suicidal, then after that superstitious and suspicious. So in this way this picture of is chosen not only from those rubrics but also from the description of this particular schizotypal. So this is the best possible or initial representation on the basis of which these drugs have come. Belladonna, cannabis indica. Cannabis indica is having strange ideas because it is out of something which is intoxicant, what we call it. So Hyoscyamus ignatia, Lachesis, Platinum, Stramonium and Veratrum album. So after this first cluster, we go to second cluster, and second cluster, first drug is antisocial. First disorder is antisocial. Here antisocial means irresponsible behavior apart from being booked by law. Aggressive, liar, cruel. These are the ingredients, and this is not homeopathy telling, this is psychiatry telling. So this is what is the picture: disobedient, impulsive, quarrelsome, moral relaxation. So if these ingredients are there in the childhood, then you know that person may get into being an antisocial person. Moral relaxation, then addictions, then kleptomania. Kleptomania, you know, thief, stealing something. So irresponsible activities and delinquency. Delinquency means criminal behavior. Now let us see this here. Alcoholism, cruel, deceitful are the rubrics which we get it. Disobedience also, then escape, attempt to escape, then impulsive, kleptomania, liar, moral feeling, want of, quarrelsome and unfeeling. Unfeeling means lack of feeling, carelessness. So remember one thing, when you choose rubrics from the repertory, do not choose two small rubrics and do not choose two big rubrics. If it is all the drugs are coming very big rubric, it is meaningless. Similarly, because for this purpose, then similarly a rubric which contains only 1, 2, 3, 4, 5 drugs, no. Too little also not good and too big also not good. So that is what you have to keep in mind. Drugs here are belladonna, hyoscyamus, lachesis, lyco, nux vomica and veratrum album. The second sister here is borderline. Antisocial and borderline, they sometimes are quite close to each other, because here borderline, it is self-destructive, impulsive, prolonged or excessive anger. Then after that, emotionally unstable, suicidal trend, high libido, sex desire is very much, and addiction, given to addiction. So these are borderline of, in fact, insanity, you may say ultimately. Then next here is about rubrics chosen from synthesis: delusion of persecution, delusion of emptiness, delusion, and then impulsive, changeable mood, rage. Rage is uncontrollable anger, suicidal tendency or disposition, violent anger and violent sex desire. Then drugs which come out here are aconite, arsenic, belladonna, causticum, ignatia, lachesis, lyco, natramur, nux vomica, opium, phosphorus, platina, pulsatilla, sepia and staphysaccharide. You can keep a list of these remedies and analyze the rubrics which are present, give importance accordingly, and finally look at the target of the treatment. And that disease or that target of symptoms, those symptoms should be covered. So that is our next one was borderline. Then third is histrionic, as I have discussed, third of the cluster. Desire for excitement, attention seeking. Here the core is over concern with attention and appearance, looks. always will put on new dress, like to put on new dress on every function. If there is a marriage, then every marriage he or she must put on a new cloth. Whether he has money or not is not important. At very difficulty he will do, but then appearance is the most important thing, and over concerned with secondly attention. Everybody's attention should be there. So desire for excitement, attention seeking. I tell you, there was a child, he used to come every time with the parents, and he was a small child, possibly maybe 8-9 months or maybe 1 year or so. Then what he would do is, I will always say hello to him. One day I forgot to say hello to him. So suddenly I found with both hands, he clicked on my table, he banged on my table. His parents were surprised. What is this? Why is he doing like this? I said, look here, today I did not say hello to him. So he wants to draw the attention. Child also wants to draw attention. In our adulthood also we want to draw attention, because I am taking these classes in a way because I want to draw attention. You are attending my classes because you want to draw attention. But these attentions are healthy attentions. And that is the part. You want to behave good with everybody because you want to draw attention. So that is normal. But what if that becomes the sole purpose? So here attention seeking is heightened, dramatic activities, then impatient person, dissatisfied easily, self-exposure, then flamboyant dress. So this is very easily determinable. You can understand, classify some patients that who have got tendencies like this. Now, rubrics. Nature wants to draw attention because it is thunderstorm, no? And amorous, which is called capricious. Capricious is also eccentric in nature. Excitement, desire for, then impressionable, shameless, because exposure is basically, shameless is the comparable word here. You can choose your own rubrics here and find the drugs. Here we have calcarea carb, lycopodium, natramure, nux-vomica, then phosphorus, platina, pulsatilla, and tuberculinum also has got a heightened score on this, and veratrum album. So these are the drugs. Now we go to the last of this cluster 2, narcissistic, and here core is self-importance. I am great. My importance is maximum. Everybody in the family is secondary to me. Everybody in the class is secondary to me, and I am the main person. Proud, superiority complex, haughty, hot-tempered, highly ambitious, cannot tolerate contradiction. There will be fight, there will be quarrel, selfish, sensitive to criticism. Such people hardly are able to take criticism. High sense of self-importance. Now these rubrics found here. Ailment, mortification. Such people are naturally going to have a lot of mortification, inner anger. Ambition is increased, contradiction is intolerant, envy, that is jealousy, haughty rubric is already there, and selfish. As a result, the drugs you find here are anacardium, arsenic, ignatia, lachesis, lyco, natramure, nux-vomica, platina again here, then pulsatilla, sepia, staphysagrina, sulfur, and veratrum album. Now we go to the another part of this cluster. Actually, next cluster, cluster C. Cluster C contains avoidant, that is oversensitive. Such people are oversensitive. Slightest thing hurts them, so they want to avoid. Timid, shy, lack confidence, then fear rejection. बात इसीलिए नहीं करेंगे मेरी बात पसंद नहीं आई तो. So that is then avoids risks. Introvert and oversensitive. This is the complex in psychiatry. We convert it into rubrics. Ailments are rejected. Ailments from being rejected. Then cowardice, timidness. Then fear in a crowd. Then fear public place. Fear rejection. Fear rejection, ailment rejection. These are two comparable rubrics. They have been added to give a better effect. Then sensitive to criticism, timidity, talk in public too. Then these drugs here are not many: ambragresia, oramet, carcinosin, then lycopodium, natramure, pulsatilla, staphysagrina, and sulfur. That takes us to next, dependent. The opposite of avoidant is dependent. that is indecisive. Core is self-critical. These dependent people are self-critical, and that is indecisive, lacks confidence, hesitant, then yielding. Whatever he explains, that will be understood. Then fear solitude, fear rejection, dependent on others. And this, the rubrics here are fear of being alone, that is fear of being alone, irresolution, which cannot decide, that is irresolution, consolation, ameliorates, then want of self-confidence, yielding disposition. The drugs which come out here are quite a few: argentum, then arsenic, aurum, baryta, carcinosin, conium, lyco, nux, phosphorus, pulsatilla, sepia and silicea.
Yielding disposition.
Yielding means whatever somebody says, he will follow it. If I say don't do this, don't write with your right hand, write with your left hand, you will start writing with your left hand. So you yield, you surrender. So that is yielding. Then finally obsessive compulsive. Now obsessive compulsive, these are the people who are obstinate, workaholic, working for long hours. Work is alcohol for them. Then perfectionist, tidy, very methodical, punctual, will always come in time. Those who are not punctual may not be OCD, obsessive compulsive. Then argumentative, will argue, discuss. Then spendthrifty means miser. Whatever minimum expenditure can be done, save money. And persistent thoughts are stuck up in the mind, cannot get rid of those thoughts. So this is the core. Then avarice, that is avarice is also miserliness. Spendthrifty का दूसरा word है avarice, that is miserliness. Then censorious means critical, analyzes, censors everything, critical, change, aversion to change. Miserliness मतलब one who doesn't want to spend money. Conjuice. Yes, miser. Actually there are communities with which this word is associated, but then I cannot take the name because there can be litigation against me, So censorious, then change to aversion, consciousness about trifle. See what is there when you talk of these words like conjuice, means spendthrifty or miser. If your own child is like that, what you will say? That he saves money. And if your neighbor's child is like that, then you will say he is miser. So that is the difference between miser and one who is economical. So actually, but over concern with economy, not even spending money on your own self. So that is miser. Change, aversion, consciousness about trifles, proper to, then industrious, then injustice, cannot support injustice. If anything is wrong is there, then there will be revolution. So internal revolution, irresolution, there is inability to decide. Then persistent thoughts. The leading drugs here are arsenic, aurum, calcarea, carcinosin, ignatia, calicarb, lyco, mercurius, natrum, nux, phosphorus, pulse, sepia, silicea, staphysagra and sulfur. So that completes about a small description of these personality disorders. The material is open to you. You can go ahead in details about exploring this and the clusters which we have said. So that I'll show you. Before that, I'll take you to Dr. Bhattacharya Brothers' book, which you already have. That is yellow book, Homeopathy Through the Spectacles of Psychiatry, and there is a blue book which is Unveiling Some Secrets of Homeopathy, the Unknown in the Known. So these two books are very helpful because they give us these good concepts away from normal, routine, traditional, on the street homeopathy, which is very popular. Today everybody wants to make progress in homeopathy, but they do not know how to make it. They want to break all the laws. They are attracted by this word. If indicated remedies fail, then give Nux Vomica. Now if indicated remedy can fail, then what about unindicated remedy? Nobody thinks. Nobody thinks of these arguments. Anyway, that is shortcuts. Shortcuts always fail. So here these two books, now clusters. Here itself it is given. all clusters and cluster A. If you analyze all these three clusters, these are the remedies which are 7 in number. That is arsenic, natrum, nux vomica, phosphorus, pulsatilla, CPM, staphylococcus. They come in every cluster. Now it is for you to interpret this. That is, they are broad spectrum. They are polycrests insofar as clusters are concerned. They are the drugs with strong mentality. So this is one aspect. Then cluster A. Cluster A is odd and eccentric, and here these three personality disorders come: paranoid, schizoid and schizotypal. They are grouped together by DSM-4 only clusters. Now here key drugs as per these clusters we have listed here: anacardium, aurum, belladonna, cannabis indica, phosphorus, stramonium and thuja have been made bold because they are more prominent, and other drugs have been listed. This is now available with you. So this is for this cluster, because it may not be necessary for you to go into those many details to particularly go to a particular disorder. And not only that, there may only be the traits of that disorder. So you pick up those cluster wise, make your work simpler, and accordingly select the medicine which is covering the particulars. So cluster B, dramatic and emotional. These are people who are dramatic and emotional. There are two, B1 and there is B2 also. Let us see B1 only, first two, antisocial and borderline. They are similar. So here these are the drugs for that. Then next is B2. Here also core is same, but then histrionic and narcissistic are quite similar to each other. So this breakup has been made for the purpose of homeopathy. This has not been written up in the books of psychiatry. So here these are the drugs. Tuberculinum is the bold remedy for these dramatic and emotional people, provided there are symptoms of tuberculinum. Always remember that. Cluster C, anxious and fearful people, avoidant, then dependent. These are the C1. Here key drugs have been listed, which main I will read: Embra, Argentum, Baryta and Conium. Then cluster C2 also same, anxious and fearful, and here it is obsessive compulsive, and main drug here is Kalikar. So that completes our first lecture today. So if there are any questions.